The comment reads, can you get it from eating it though? I'm guessing it's airborne like the flu and COVID. So the far bigger issue here is that it is already way out of control, despite the health officials telling everybody, oh, it's fine, and pretending that everything's good to go, when it's clearly not. They really aren't tracking. Any ranchers or farmers, it's all like self-attestation. So if they notice that their animals are getting sick, they can request testing. But if you consider some like large ranchers that might see an outbreak might not want to say anything, because that wouldn't be good business now, would it, if you got a whole bunch of attention that your animals were sick. The other major issue is just the lack of transparency. So say an individual would become sick after working on one of these farms, right, or they were asymptomatic, but a family member started becoming ill, and they went to the doctor, and the doctor tested them and found out they had like influenza A. H5N1 is an influenza A virus, but you will not know that based off the influenza A, positive test, that it's H5N1. For that, you need the genomic sequencing. The very same genomic sequencing that the health agencies failed to upload to GSED. And in some cases, they waited weeks and weeks before they did a major data dump, but didn't include locations or anything regarding the sequencing. So we're flying blind. The other issue is that they've utterly assured the public that pasteurization, absolutely 100%, nothing to worry about, kills the virus, blah, blah, blah. When we don't have any data to support that, with H5N1 specifically, and why this becomes relevant is because we know that with like the hand, foot, and mouth disease viruses, that those can survive the pasteurization process because of the fat globulin provides like a protective buffer. So the major problem I have is they are making very sweeping statements, asserting with 100% confidence that everything's fine, when we really don't necessarily know that. I would imagine that the risk would be low, but if we don't know, it's not going to hurt me to use skim milk or almond milk, coconut milk instead. I can do that until at least I acquire a little bit more information, especially with something that has a 56% mortality rate. Now, what I will say is, like, an added caveat is that even though, yes, like with all the cases we have tracked over the last 20 years that has had a 56% mortality, so out of 800 or so people infected, more than 400 died. That may be a slight overestimate because we don't know how many people those contacts had that they may have spread it to, and they were asymptomatic, and we don't know that. We didn't necessarily do as extensive as testing early on, so it's kind of hard to say. We know though that the people that were presenting with symptoms, 56% of them died. So in light of everything that's happened with the SARS-CoV-2 pandemic, where I watched and reported in real time their failings minimizing and cover-up, and I'm now witnessing that, no, we've learned nothing, it doesn't instill a great deal of confidence, I gotta tell you. Because the thing is, it's not like we don't have a way to figure this out.
The USDA and CDC keeps releasing data qPCR tests showing H5N1 presence in the milk, but this test cannot determine if the viral particles are infectious or not. There are simple ways to circumvent this. For example, the technique described in the paper below 3 years ago combines Propidia monoazide PMA to the qPCR method, enabling a rapid discrimination of live and dead SARS-CoV-2 in about 3 hours. PMA is a photoreactive dye and it can bind to inactivated SARS-CoV-2 virions, but does not bind to viral RNA instead by virions. The formation of PMA RNA conjugates prevents PCR amplification, leaving only infectious virions to be detected. To weaken detect if H5N1 virions are presented in pasteurized milk are infectious or not, in an assay that lasts 3 hours. We are just not doing it for some reason.
So as a recap, they have the tools. They just don't possess the competence. So what I've learned over the last 4 years is no, I don't trust them with my life. I don't know about y'all, but my 5-year plans are really off track. Also, hey, sorry, it's future me here. I made it all the way to the editing process when I realized I didn't answer your actual freaking question. One of the ways that they think that all the cats in Poland had acquired it was through ingesting raw chicken. There's also been a lot of discussion about whether or not the cows could have been acquiring it through ingesting tainted material. So again, no confidence.